Is your new pup or kitten exhibits signs like stunted growth due to poor weight gain, breathing difficulties upon exertion, coughing or gagging, nasal discharge that may include milk or signs of pneumonia? You may have them checked right away because they may be suffering from a condition called cleft palate. What is cleft palate and what can you do about it? Stay tuned. What's up guys, my name is Dr. Tresho and every week I post videos, cases, topics, and tips on how to better take care of your fur babies. And this week we are going to talk about cleft palate, yung pagkabingot, no? But before we proceed, please hit like, subscribe, and the bell button so that you get updated for whenever we post new videos in our YouTube channel. We are on Facebook, do follow us there. Dr. Animal Wellness Center yon, ha? Or we are also on Instagram, Dr. Animal Wellness Center, and my personal Instagram, Tresho. On with our topic for today, cleft palate. It's a relatively common condition that results from the failure of the roof of the mouth. Yun yung hard palate at saka yung soft palate niya. May roof kasi dyan eh. Minsan, hindi yung nagko-close. No? To close, hindi nagpa-fail siya mag-close during the embryological development, thereby leaving a cleft in the roof of the mouth. Nagkakaroon ng butas doon. No? This condition is most often discovered as a birth defect in very young puppies who may show a round belly, malaki yung tiyan, pero dede ng dede, just as healthy puppies do. Kala mo, healthy niya, but are failing to thrive. Ang lakas niya dumede, ang laki ng tiyan, pero napapag-iwanan siya ng ibang mga kasama niya, no? Or fail to gain weight. It is imperative to visit a veterinarian if you suspect that your puppy is becoming malnourished. A cleft palate may cause the newborn pup to have an inability to suckle the mother's milk. It may appear that he is able to drink and gain nourishment, but he's actually taking in air only. Hangin lang pala. Kaya pala, lumalaki yung tiyan niya. This is the reason for the round belly that you see. Older puppies with a mild cleft palate may show less distress, but a visit to the veterinarian to determine the extent of the cleft palate is crucial to your pet's well-being. Yung iba kasi may malaking butas, yung iba kasi may mas maliit na butas lang, yung iba kasama pati sa ilong. I-discuss natin yan isa-isa. The result is a puppy or kitten whose oral cavity communicates with their nasal passages, diretso sa ilong. This leads to problems in unang-una sa pagkain, sa paglunok, and receiving enough nutrition. But has respiratory implications as well. Kasi connected siya sa respiratory tract, right? While environmental factors during gestation of the mother, habang buntis pa yung mother, may theoretically yield cleft palates, this is generally regarded as an inherited condition. As such, purebred pups are far more likely to suffer these defects. This is especially the case for brachycephalic or short-headed breeds and bulldogs in particular. So ano nga ba yung mga clinical signs and how do you actually see them? Now, a cleft palate typically looks like what it sounds like. A hole in the roof of the mouth. Etong hole na to may be larger or smaller and it may vary in location also. Yung iba, closer to the front of the mouth, may sa ilong, no? Iba dun hanggang sa back of the mouth, no? But most are readily identifiable at birth. Yung ibang cleft palate defects may extend as far forward as to the tip of the lip, pati doon sa nostrils, makikita mo pati yung ipin na naglalabasan, no? If the presence of a cleft palate isn't identified by visual inspection, titignan mo pa lang ng pups, individual oral cavities immediately after birth, the most typical signs that one or more pups in the litter may have a cleft palate involves difficulty in suckling and swallowing. Yung hirap dumede, hirap lumaki, mag-iiwanan, so ayan. Ito pa, yung coughing, gagging, and milk bubbling from the pup's noses is typical of cleft palate defects, as is sneezing and snorting. Other signs, usually in less obvious defects, may include failure of a pup to grow normally, a sudden onset of pneumonia, typically from aspiration, no? Or sudden death. Minsan hindi na na-identify kasi bigla na lang namamatay yung puppy. Nakalimutan pala nating i-check yung roof ng mouth, may butas pala. Usually stunted growth due to poor weight gain, breathing difficulties upon exertion, coughing and gagging. Ito nga yung usual sign. And nasal discharge that may include milk or food. Infection or pneumonia due to food aspiration kasi nga directly in contact yung mouth doon sa nasal passages. Minsan, yung pagkain o yung milk dumediretso doon sa trachea going to the lungs. Sometimes, it eventually ends up to sudden death. No? Sino? Yung mga affected breeds. So yung mga bulldogs, 30% more likely to suffer from cleft palate sa lips and sa cleft palates talaga sa ibaba than other breeds. Another found that bulldog breeds were at exceptional risk for cleft palates while German Shepherds and mixed breeds were at the lowest risk. Sila yung may pinakamadalang na makitaan ng mga ganitong klaseng conditions. Ano-ano ba yung klase ng cleft palate? A cleft palate in your dog can be described as a primary cleft palate. Ito yung found on the lip and also known as hair lip. Yung makikita mo yung sa ilong, yung isang butas, pwedeng dalawa pa nga ganyan Makikita mo na yung halos yung mga ngipin niya na lumalabas na, no? So yun yung primary cleft palate o yung hair lip na tinatawag natin. Yung secondary cleft palate naman, which is what we are describing here, whereby the palate does not fuse together in the normal fashion. So yung cleft palate kasi, kuha ko na drawing. Mas maganda kasi kung ma-drawing natin. Ito, kung halimbawa yung roof ng tongue, so may ridges yan dyan, no? Yung ipin, kung baby pa yan, hindi natin masyado makikita yung ipin. So imagine mo nakaganin yung nakahiga. Ito yung teeth, no? Nakahiga siya, daming teeth. Pero nandito yung butas. Makikita niya may butas, minsan may ganyang kalaki, minsan maliit lang ito. So yung pagkain kasi mula dito sa mouth, pumapasok siya doon sa ngala-ngala, sa nasal passages. Kaya nasisinok, nasasamid, lumalabas yung gatas or yung pagkain doon sa ilong ng aso natin. A cleft palate in the soft section is described as a hole in the swallowing portion of the mouth, and the cleft may be found on both the hard and the soft areas of the mouth. Meron tayo kasi hard palate, ito yung nandito sa rostral, and then yung soft palate na doon na sa bandang likod, malapit na sa trachea. No, minsan doon lang sa hard palate, minsan in the junction between the hard and the soft, minsan from the hard palate directly towards the soft palate, kaya talagang bukang-buka talaga. Yung kanyang soft palate na separation extended mula dito sa hard palate, ito nakikita niyo, but all the way down to the soft palate. Ayan, no? Nakabuka siya doon. Kaya siya prone sa mga problema. So we're going to unite these two again. Katulad ng ginawa natin doon sa hard palate. Okay? Sinasabi natin, no? Yung soft palate niya, okay lang din naman po. Kasi ang i-repair natin is pinagdikit na natin. So parang in effect, mas makakahinga siya ng maayos, mas less na yung nasal discharge niya. And no need to repair the elongated soft palate dahil hindi naman siya ganun ka-elongated. Ayan, no? Okay? Paano natin madadiagnose yung cleft palate in dogs? So in your dog's primary cleft palate, yung diagnosis is straightforward. Kitang-kita mo na sa ilong at lumalabas nga yung ipin, no? At saka yung bingot lumalabas na rin, no? By looking at the appearance alone, with teeth possibly showing or an oddly shaped nostril. So minsan dadalhin natin yung pups or yung kitten doon sa vet. Kasi lagi sinisipon o kaya may mabahong amoy na lumalabas doon sa kanyang sa ilong, no? Perhaps medyo na-notice mo yung aso mo with difficulty breathing when exercising. There are numerous reasons to suspect a cleft palate. Kung pinagsususpetsuhan nyo na at kung tingin nyo may cleft palate, dalhin nyo na talaga sa veterinaryo para masuri na ito. Ensuring your pets continues to be healthy and happy. No? So, kapag dinala nyo sa veterinaryo and titignan yung ngala-ngala, pag nakita na dun sa hard palate niya may butas, ayun, the diagnosis speaks for itself. Parang okay lang naman, no? Ito yung kasama niya. If you notice, mas malaki ito. Pero mga same litter yan. Look at the size difference, so. This one, so they came from the same litter. Yung katabi niya, ang laki. Pero siya mas maliit. Ayan, oh. And then when you examine them out, I don't know if you can see it. Ayan, oh. Ayun. Butas. So you can see the difference. Yung he was able to thrive naman, lumaki, nabuhay, was able to survive. Pero yung size difference of this one and this one, ang laki. Hopefully, if we can fix it as early as now, sana makahabol siya. So, to properly observe the soft palate, your dog will be put under anesthesia. Kasi minsan, hindi na natin nakikita yun eh. Kaya kailangan natin ng sometimes mild sedation, so that your veterinarian can look deep into the oral cavity. Kailangan din minsan ng thoracic x-rays. It will help, to check for signs of pneumonia. Kasi nga, baka magkaroon ng aspiration pneumonia or posible ito mangyari due to the aspiration of food. So, paano ba ito gagamutin? Paano ito minamanage? Sadly, many cleft palate pups are euthanized immediately after the defects are detected. Yeah, yun ang katotohanan, no? If handled with sufficient care and diligence, however, many of these pups will survive. Karamihan kasi sa kanila, hindi na yung failure to thrive, hindi na sila nabubuhay. But if elected treatment of cleft palate depends largely on the size and location of the defect. Depende sa laki at kung nasan ito nakapwesto. And the degree to which the affected puppy is currently affected. Some pups may already be suffering from pneumonia o kaya malnutrition, which makes it difficult for us veterinarian to handle the situation. So, anong gagawin natin dyan? Bottle feeding or tube feeding of small quantities of milk every 2 hours is a typical recommendation for neonates. If you're not up to it, in some owners, talagang tumatang sa doc, hindi namin kaya ganyan. So, I don't think the puppies will survive anyway. Minsan yung mga breeders, hindi nila mabebenta na. So, pinaput down na yung mga puppies na ganito. But however, older pups maybe transition to solid foods as early as 4 weeks of age para lang maiwasan na yung pag-aspirate ng milk doon sa trachea. Kumbaga, maaga pa lang, kung masurvive ng puppy yung first 3 to 4 weeks, at as early as 4 weeks, tinatransition na agad sa solid food para mas lalo makapag-cope yung puppies at lumaki ito, makabawi. Assuming no serious complications ensue and pups are healthy enough, surgical correction may be advisable after 4 weeks of age. So, isang buwan, pwede na natin correct yan. Each patient's individual health concerns and palatal defects details will inform the ideal timing of surgery and the technique selected. Several surgical procedures may be necessary as these pups grow and their palates expand. So, madaming surgical corrections na pwede tayong gawin. Depende nga sa location, size, at saka yung health status ng ating puppy. No? So, for this reason as well, as for reasons related to anesthetic risk, surgery is considered a last resort, best undertaken later in puppyhood. Kung mapalaki nyo ba siya, mas maganda. When the palate is closer to its adult size. Kasi baka pag kinrect natin ng habang maaga pa, baka mabutas ulit, babanat, and will recurse into a second surgery, second procedure, which is usually the case. Yung cleft palate pala surgeries have historically suffered a low success rate. So medyo mataas yung failure kapag ginawa sila as puppies. So, ang ginagawa namin, pinapatagal pa namin ng onte, mga 3 to 4 months and above para talagang mas healthy na at kayanin na ng puppies yung sedation and anesthesia. Because it is also very taxing to the body of an infant or of a puppy or kitten. It is also very important to note, however, that even after successful surgical correction, long-term complications as a result of the cleft palate defect are possible, even likely. These dogs are at high risk of upper respiratory tract infections, and some will suffer chronic nasal discharge that may or may not be definitively treatable. Pwedeng mayroon na siya permanent na problem sa discharge sa ilong. No? In some cases, your pet will need to be fed by tube for 7 days after the operation. No? Depende yan sa veterinary nyo. Your veterinarian also will then discuss the best way to proceed. As of diet for the next 6 weeks, minimum is usual protocol. No? Case-to-case basis. Depende sa condition kung saan nagsimula at kung paano aatakihin yung inyong veterinarian. Ito, pag-usapan naman natin, magkano nga ba yan? Which is usually the next question. Doc, magkano ba ito? The veterinary cost of a cleft palate depends on the severity of the defect, the skill and the diligence of the human caretakers, and the need for surgical correction. If surgery is not deemed necessary and no complications arise, few veterinary costs will be incurred. Usually, yung ballpark figure, depende rin sa weight, sa stage ng aso, no? So, doon nagmamatter yung cost. At kung gaano katagal siya lalagi sa clinic. No? So, if a surgical treatment is deemed advisable, expenses can run up to mga 25 to 30,000 pesos. Kasama niyo yung confinement dyan, gamot, bills sa surgical cost, pati yung vet cost. No? Long-term complications of cleft palate defects, significant enough to require surgery, will almost certainly occasion the need for follow-up veterinary care. These future expenses should not be ignored by prospective. So, hindi porke natapos na yung procedure, tapos na. May mga follow-up na visits to the veterinarian. And sometimes, the need for a second surgery nangyayari yan, no?
This was fixed before pero may natira pa rin. Nangyayari talaga yan. So we'll fix it again until maayos natin.
Prevention. Paano ba natin maiiwasan ito? Prevention involves breeding more diligently for traits that will minimize the risk of cleft palate defects. In general, breeding for exaggerated traits related to shortened head, snub nose, and compressed airway structure will increase the risk of cleft palates. So, kung meron na rin history ng cleft palates yung inyong aso, na-repair, lumaki, pwede yan ipamana doon sa mga susunod yung baby. So, hindi na natin i-breed yan, ikakapunin na, or is-pay na if it's So if you have questions about our topic for today, please visit any of our Dog Friends Animal Wellness Centers in Timog, UP Town, and North EDSA. And here are the numbers to dial. If you live near Cavite area, we have a clinic in Silang along Aguinaldo Highway. It's called Wags and Whiskers, and you may reach them through these numbers. Or you may check our website by typing www.dogfriendsawc.com for further information. So if you like this episode today, please like nyo naman. And share it also. This has been your friendly neighborhood veterinarian, Dr. Stresho. And see you again next week. Charan-chan, charan-chan, chan.